right, 5 minutes after 10 o'clock. Thank you for tuning in. One of the things that I think we're witnessing as human beings is that we are progressing. Obviously, the world has different fractions that seem to be regressing, going the other direction, but we are progressing. And I'm not talking about technology. I'm talking about understanding each other, understanding ourselves, and when our soldiers go to war, we just had a show an hour ago, the Veterans News program, and so many of the men and women who we've met on that show, the show's been on the air here in WOCA for over 10 years. So many of those men and women have told us stories of post-traumatic stress disorder, and some of the older guys, the guys from World War II, would call it shell shock. Others would call it combat exhaustion. We had a discussion once, and I even remember the soldier's heart being one of the ways that it was called, or what it was called, irritable heart. Whatever it's called, it's it changes the person who has seen the horrors of war, or perhaps even has seen the horrors at home, if there's been anything that somebody has witnessed here at home. It's an interesting topic, and I don't know even one grain of sand worth compared to our next guest. He is not only a resource to go to for PTSD, but he's also a talented author, it turns out. Dr. Steve Stahl is on the phone. He has written so many books. Let me see, where did I see this? He is an expert on PTSD. I'm reading from the back of his book now. He has been cited as one of America's top psychiatrists. He's one of the best doctors in America. He has written 33 medical books, edited 10, authored over 500 articles. He was a professor of psychiatry at Stanford, UCLA, and now teaches at the University of California in San Diego, where I'm guessing he is, which means he got up early to be with us this morning. He's on the air to talk to us about his expertise, as well as his new book called Shell Shock. It is a thriller novel. Good morning, and it's an honor to say good morning to you, Dr. Steve Stahl. Good morning, Doctor. Good. Boy, I hardly hear you. Something went awry there. Is your phone hardly connected or something? Very, very vague, very, very faint. Did something move? You sounded so clear before we went on the air. Is there a loose wire or something you could wiggle? All right, can I be so bold as to ask you to call back? Okay, thank you. All right, I'm glad he could hear me anyway. So he'll call. Yeah. He'll call right back. So
it was just a difference between night and day between off the air.
Gosh, and I don't even know if the listeners could hear him. It was really, really tiny little bit of sound. All right, I'll just wait for that light to come back on.
Okay.
Anyway, I know this is a topic that is of interest. We had a couple of stories I remember from Veterans News of men who had. I think there's one example. Here he is. All right, let me go to him. Doctor, you there? Oh my goodness. It's such a small sound. Can I, just in the event that it's on our end, can I give you a different phone number, please? 352-622-9622. Okay, thank you. And what that will mean for the listeners, you will not be able to call in, obviously, because he's calling in on the line that you guys normally call in on. So I apologize for that. I have no idea what happened there. It was fine just before, and I know I'm doing everything right on my end. Let's see if I got him now. Good morning, Doctor.
Good morning.
Yeah, now clear. Maybe it is on our. I have no idea.
Yeah, we'll have to check that out real quick.
You're calling in on the line that the listeners normally call in on, so I just informed them that they will not be able to call, which normally we invite our listeners. Well, thank you for being on the air with us. This is going to be a great conversation. Is this your first novel? I know it's not your first book.
Yeah, it is my first novel. I've written, like the others were textbooks, but this was a novel.
Was it different for you, and do we learn from the novel as much as, well, maybe not as much as the textbook, but do we learn about PTSD?
Yes, I thought it would be interesting to appeal to perhaps a greater audience than just geeks like me who read textbooks. And so I tried to tell a story that was educational, and most of the story actually is true. So it's a story that links a World War I British soldier who was treated for shell shock went back to the trenches, had his symptoms come back, and so they shot him with a firing squad, which is how they treated the hundreds of soldiers, both on the German and on the British side, due to a misunderstanding, a shell shock in that time when they thought it was just cowardice, so they just shot them.
Wow. Okay, I have a question. I've always had this about the PTSD subject, but I've never asked anybody. So let me ask it, and it's probably going to come out awkward. I've never been to war, so I don't know what it's like. Is PTSD because you witness somebody being horribly killed? Is it because you yourself are afraid for your life for day after day after day? Is it a combination of the two things? What is it actually caused by?
Well, it is, by definition, you have to witness a terribly traumatic thing. Could be war, could be a natural disaster, and of course in domestic circumstances, police and fire see that, but so do people who are sexually abused. So those are horrible things, and it's very interesting in that it appears that we don't all have it. In other words, if you take 100 people and have them witness the same or even experience the same thing, about half of us will be upset a lot for a few days. And if it goes away within a month, by definition, it's not PTSD. It's an acute stress reaction. But if it lasts more than a month, that's about half of those people. So 25% of people who witness a calamity that's just horrific will get PTSD, and 75% of us won't. And so it leads to the questions of who's resilient and who's vulnerable and why. And right now it looks like a combination of nature and nurture. So in other words, your previous life experiences may make you tough or vulnerable, and the genes that you inherit can do the same. And so we don't know what those factors are, and we cannot yet identify who is vulnerable or resistant. But even the Marines, if you take 100 Marines and put them in firefights, there's kind of like a dosing effect of a firefight. Marines will get more and more PTSD until they've been in firefights up to 5. But after 5 firefights, they don't get any more PTSD. And 25% of those Marines will have had it. So there's something that we need to discover about human nature that makes some of us vulnerable to this.
And sometimes people don't even realize that they can get it from everyday occurrences. I know when that TV series was on, Sons of Anarchy, you heard news reports coming out. I mean, these are normal people. They thought they were watching for entertainment. There was horrible things going on there. And then all of a sudden they developed this anxiety. They didn't know what it was caused from, but yet they traced it back to that show.
Yes. And most of those people, though, will have what's called an acute stress reaction, and it'll go away after 3 days, and it lasts between 3 and 30 days. Why is it that some of us are vulnerable and some are not? It's a good question, but it's part of human nature. And just because you get shot in the liver and you bleed doesn't mean you're a coward. And just because you witness a calamity in warfare and get upset about it doesn't mean you're a coward either. It's just the nature of people's brains. It's interesting, you know, if you give morphine to a soldier on a battlefield within an hour of his injury or her injury, you'll find that there's almost no PTSD. But if you don't, there's about a third of people get PTSD. So there's something about the memory that's formed when you're really emotionally aroused that's burned into your brain, essentially almost irreversibly. And there appears to be the chance to disrupt that very early in the process, but we're not doing enough to study that.
Do you speculate on the biological reason for it? Is it to prevent us from doing something that'll harm us again? And can I use maybe a simplistic example of this? I was in a car wreck in the rain in the night, and for a while there, and I was listening to a specific radio program, yeah. And so for a while there, I wouldn't drive. I didn't like to drive in the rain. I didn't like to drive in the rain at night, and I definitely didn't like to drive in the rain and the night when that radio show was on.
Yeah.
So I was almost like superstitious, and it took about a year before I finally was able to shake that.
Yes, that's a very good example. The brain essentially has emotional memories, and they can be triggered by any of the things that occurred at the same time of the traumatic event. and they're essentially biologically conditioned, if you will. It's almost like a Pavlovian dog, is that you involuntarily get this memory, and it burned into your brain, essentially. And anything, whether it's the smell of something that occurred, whether it's the sight or the sound, there's sensory experiences. When you re-experience that sensory phenomenon, the horror of what was associated once with it comes flooding back into you. And it's an involuntary reflex in us, and those of us who get it. And it's a spectrum, as you say. Some of us get it for a while, and some of us get it for a lifetime, but it does fade in some. But one of the points I was trying to make in my book is that we need better treatment. You know, the U.S. Army doesn't do enough, I was saying in the book, to test this on the battlefield. The Army invented medevac and paramedics and triage and trauma care. And there's an old saying that the best place to get a gunshot wound or a blast injury is right outside an Army hospital. But the other part of that saying is that one of the worst places to get PTSD is right outside an Army hospital. We don't have enough treatments, and they're not looking at it seriously enough.
And so when they are looking for treatment and this treatment has to be delayed, why can't they go off the base to other professionals?
Good question. One of the things that I'm proposing is that the way to treat this is not to dump it into the VA 6 or 24 months after the PTSD has been ingrained into your brain, but to use the battlefield as a laboratory almost, where we are looking for treatments that are instituted very soon. And even one of the ideas that actually my character in this book testifies from Congress at the end is to take a chapter out of the book written by the NFL. We used to treat concussions by throwing people back into the game. Right now, we sit them on a bench. It could very well be that we have to do the same thing with warriors, that if they have a traumatic injury of some sort or witness an experience like that, that maybe they have to be sat on the bench, rotated to the back lines, not sent home, but allow them to decompress, be able to get a good night's sleep without having to be poisoned essentially to sleep with bad drugs and so forth, but natural sleep, and maybe exercise a bit and then go back into battle. But if you keep throwing yourself into the situation once you're traumatized, you might be able to do it, and you might be tough, but you'll come home with PTSD.
Something just clicked in me as I was listening to you talk, Doctor, and here's what it is. It sounds like there are things that need to happen, and when things need to happen, you need to have people behind those things and they have to understand it. And if you wrote a textbook, 99% of us would never even see it, but when you write it as a novel, we read it, we get it, and we speak up about it. And then if it's made into a movie, it's even more likely to reach more people. Yeah, for some reason, there's a lot of people who don't read books and watch movies, and that's just the way it is. So I think what you've done is you've taken your area of expertise and loaned it to a well-written, well-crafted story. In fact, I'm not the only one saying it should be made into a movie. In fact, where did I read that? I think it was on the cover of the book somewhere. But I really think you're probably doing something really amazing just by putting it into a novel. Let's take a little break, and we'll be right back with Dr. Steve Stahl. You're listening to WOCA Ocala. We'll be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. For today, partly sunny skies, breezy and warm with a shower in spots. The high 82 to 86. Partly cloudy tonight. There may be a shower along the coast. Low 63 and a few inland spots, but closer to 73 at the coast. Tomorrow, times of sun and clouds and breezy with a stray shower along the coast, high 82 to 86. For Saturday, sunshine, some clouds and a passing shower with a gusty wind, high 82 to 86. From the Florida Weather Center, I'm Joe Lundberg.
Coming off their impressive 20-point victory over Louisville, the Florida State Seminoles travel this week up to Atlanta, Georgia to take on the Georgia Tech Yellow Jackets. This game is a 7 o'clock kickoff right here on WOCA, brought to you by Tri-Eagle Sales and Distribution, your Bud Light distributor in the Ocala area. Don't miss it. 7 p.m. kickoff right here on WOCA, the source.
20 minutes after 10 o'clock. Thank you for tuning in. If you ever want to do a radio talk show and you want to have great guests like Dr. Stahl, you need to get some great publicists. And the publicist who introduced us to Dr. Stahl is a guy named Sam. We talk to Sam all the time. Mm-hmm. And when Sam was telling me about Dr. Stahl and about the book called Shell Shock, and Sam knows this. He knows that if it's a novel, I'm typically going to say, let's do 10 minutes because it's a story. You don't want to give out too much of the story. You just want to give the listeners a hint of what the story is about. And B, you kind of run out of things to say when it's a made up story. But in this case, it's A, not completely made up. But B, the doctor who wrote the book has so much information about a topic that comes up on this radio station so often. Mm-hmm. PTSD does. That being said, I also want to be fair to the book. I want to be fair to the story. Dr. Stahl did put together a wonderful story, and I want you to read it because I know you're going to like it. So let's get the doctor to tell us about the story a little bit. Dr. Stahl, thank you for waiting through the break. So who is Dr. Gus Conrad? This is a doctor in your brain, right? You made him up?
Well, I made him up. He's a little bit based on me, as a matter of fact, and some of the experiences that he had in the book are the ones I've had. I've actually taught at Fort Hood, actually just before the shootings there, as a matter of fact, where I found out that soldiers were not being treated very well by psychiatry, and they were over-medicated and had lots of delays in getting treatment. And I wrote a report that wasn't very flattering, but I thought truthful, and I was able to go to the Pentagon to meet with the Chief of the Army, and they more or less didn't want to hear about it.
Oh, no.
And that was also a part of the story, which is true.
Oh, my goodness. Were you threatened as Dr.
Gus?
Dr. Gus Conrad? Were you threatened as he was?
Well, actually, I was, and not as explicitly as he was, but yes. They're not very happy to basically divert their attention away from the battle and away from using their funds for weapons. It would be very expensive to actually do the right thing, which is perhaps rotate troops. Never before have we put people in harm's way for 10, 15 years and having people spending half of their time on deployment after deployment. And that's just the way this war had to be fought. But you're right, Larry. I guess it was really amazing. You said something about trying to tell a story to a broader audience. Is exactly what I'm trying to do, because I think if people want to realize that in today's world, if you fight a battle, you're not going to be killed. Chances are, in the Civil War, 3 out of 4 soldiers were killed. In our war, 5,000 were killed, 50,000 were injured, about a third seriously, and 500,000 got PTSD. The nature of modern warfare is to get PTSD, but we've got lousy treatments for that. And the Army, I think, should be encouraged, if not getting your readers and your listeners behind it, to try to help encourage them to let's look for better treatments and not just dump these folks into the VA.
And have some of the people that have had PTSD been deemed mentally insane, and then therefore they have been criminalized within the system?
Yes, absolutely. You see, the idea is that if you have good leadership and good training, and you still get PTSD, it's your fault. So you probably came into the Army with your own problems, and so it's not something they're going to give you a pension for because it was some weakness on your own part. So to heck with you.
Oh.
And that's really not the way it should be. If you get shot, it's not your fault. And if you get PTSD, 25% of us are walking around candidates for the Army to get this if we go into warfare. It's not our fault.
Do I want to tell you how smart our friends in the veterans organization here in this town are. They got together with the local court system, and I think it's kind of a pilot program, and it's called Veterans Court. And there's one judge who has volunteered his time to listen to cases that are specifically law violations that there's good reason to believe that perhaps PTSD might be underneath it all. Not to give anybody off the hook for committing a crime, but if they can trace it, then it's not only about punishment, but it's also about rehabilitation and getting the right treatment for those people. Mm-hmm. It's a very interesting and very smart program.
I've heard about those programs, and they are very interesting and very smart. And the idea is that PTSD is complicated often with depression, with substance abuse.
Yeah.
Those are treatable. Sometimes the flashbacks and the nightmares are somewhat treatable, and you can take the edge off with medicines and some different psychological therapies like exposure therapy. But often it's those complications that really cause trouble. If you're intoxicated, you might argue or even hit your wife. You might drive while intoxicated. People do things out of desperation, and those can be treated.
In the storyline of the book, just to kind of go back and forth between real life and the fictional story, the story is called Shell Shock, by the way, and Steve Stahl is who you look for. On the cover, it does not say Dr. Steve Stahl, but no. he is a doctor. But your character, Dr. Gus Conrad, who we mentioned earlier, he's kind of fearing for his own life because he knows the truths about certain things. And if that is revealed through your story, you have done an amazing thing.
Well, thank you. And what I want to do is to mobilize your listeners and our readers to actually put pressure on the Pentagon to find a treatment and a solution for this. The Army did a wonderful job with blast injuries. If they just put their attention to this, my sense is they would crack this problem. The problem with this problem is that we don't pay attention to it. We would rather ignore it, but it's so problematic, it's not going to go away. If we put troops on the ground in ISIS and any other future warfare, we're going to manufacture 25% of those soldiers, and Marines are going to come back with PTSD. And shame on us if we don't do something about it, because it's entirely predictable now.
This is what I heard. I heard that when troops come back from Afghanistan, one of the questions they're asked is, do you feel like you need psychiatric help? And quite often, the soldier will just say no, check the box or whatever that says no, and then they're moved through. Nobody really looks into them. They just ask the soldier the question. Yeah. And of course, the soldier just wants to get home. He doesn't want to take any more time with anybody else. He just wants to get home. And I heard that was part of the problem.
Yeah, absolutely. And the other thing is that who wants to be called psychiatric? It ends your career.
That's right, yeah.
It gives you stigma. When I went to Fort Hood, and people called PTSD sufferers fakers, slackers, whiners, and nobody wants to be called that, so they suck it up and deny it. And then, of course, they're deferring their treatment, and the longer they go, the more of this gets burned into their brain, and the less treatable it becomes. So the culture of the Army is not a productive one right now. It could change to make people be able to get treatment early without ruining their careers.
Doctor, thank you for what you're doing, and thank you for getting up early. You're on the West Coast, right?
Yes, I am.
Well, thank you for getting up early. The book is wonderful. I think you have a second career waiting for you. You're obviously a talented doctor and a gifted, giving man. I have a copy of the book. It's called Shell Shock. It is a book you will like, and I think Luann Brizendine wrote a comment on the cover of the book. It says, Shell Shock is not only a page-turner, but a tour de force first novel by renowned psychiatrist Stephen Stahl. It is sure to be a major motion picture.
Wonderfully written, by the way.
And if it is, then your mission is even quadrupled. I think a lot of people see movies. Call me if you want a copy of the book. I'll take the call after we're off the phone with Dr. Stahl, because he's on the line that you guys normally call in on. But the first person to ask for it will get it. The rest of us have to go buy it. Doctor, do you have a website?
SteveStahl.com.
Let me spell Steve's last name. It's
S-T-A-H-L.
There you go. You're quicker than me. Steve Stahl. And by the way, Robin will put this on Facebook, so you'll be able to just look at the link. If you can't write it down, don't worry. It'll the interview itself will be on Facebook, and the interview will also be on the WOCA YouTube channel. So, and that'll be by 2:00 today. Doctor, again, thank you for being on the air. Thank you for what you're doing. And I think the first time ever I've really understood, at least maybe now I have 2 grains of sand worth of knowledge about PTSD. Dr. Stahl,
thank you for having me.
Thank you. All right, we'll take a break and we'll be right back.